They're known as migraines. For many, they can control your life, but there is some hope for relief.
Thank goodness. This morning, Dr. Brian Healy of Fort Myers Acupuncture and Massage is talking with us about acupuncture. Doctor, thank you very much for being with us this morning.
Oh, my pleasure. My pleasure.
Okay, first things first.
Yes.
Acupuncture for migraines. How does this work exactly?
Yeah.
In Chinese medicine, the idea is that the pain from migraines and headaches is related to a deficiency or a blockage in the circulation.
Okay.
Now, in Chinese medicine, we talk about the circulation of blood, of lymph, but there's also this concept called qi, which is like vitality. It's the ability of the body to heal. It's the organizing, intelligent principle that guides the circulation.
Right.
So in acupuncture, we talk about how the qi flows through various channels or meridians in the body. Okay. The acupuncture points lie along those meridians, and they act like little switches or valves that help to control the flow of qi. So sometimes a headache can be from too much circulation or qi in the head. Sometimes it can be from too little. So when we have an acupuncture patient, we do a very individual evaluation to see what the underlying cause may be. In Chinese medicine, headache and migraine is actually considered a separate disease. So there are many causes for that. And like say, for instance, you both had migraines. If you came to my office, you might get completely different treatments, even though your symptoms were very similar.
Interesting.
Okay. So we kind of want to demonstrate here what it's like, and we were talking in the break a little bit. It's not painful. Kind of walk me through the process. You're going to kind of do it in my hand here so we can show what
Correct.
it looks like.
Right.
But walk us through the process of how you determine where you're putting it, what you're doing, those types of things as you do this, if you want.
Right. Well, the big thing is the intake that I have with a patient.
Okay.
I find out about where all the details of their symptoms.
Right.
How long they've been having the headaches or migraines, where they show up. You know, different parts of the head can indicate different etiologies or different causes for the headaches or migraines. Other extenuating circumstances, like are they under stress, or if it's a female, is it associated with a particular part of their hormonal cycle? So we get as much information as possible, and that then helps us to come up with a specific, what we call a point prescription. So that'll tell us which points to use, because there are many different points that can help a headache, but we want to be very specific and use as few needles as possible at the most appropriate points for an individual.
Okay, so do you want to try
Sure.
that on me?
Yeah, very commonly the points that we use would be not just in the head. We do use points in the head, but also in the hands, the wrists, the feet, the ankles. Okay. So I'd be happy to demonstrate.
Sure.
Yeah.
Go for it. So if you have a patient come to you with complaints of migraines, the hand is a go-to place to combat that.
Yes, the hand and the ear, actually. In addition to the acupuncture needles that can go in the hand, in the knee, in the head, in the ear, I also use these little pellets, these little adhesive Band-Aid pellets that can go in the ear. So we have a lot of different treatments. It doesn't have to be needles.
Okay.
Okay.
So if you have a needle phobia,
let's do this.
You can get the pellet.
Exactly, and I also have I also do laser acupuncture, where these fiber optic cables attached to the acupuncture points, no needles involved at all. But in this case, so my hands are clean, and I have a alcohol swab, and I'm going to just clean the skin. We're going to do a point here, and we're going to do a point right there.
Okay.
Okay. Now, you will feel, here's the needle, and you can see the red of the handle of the needle. And then there's something called a guide tube around the needle.
Right.
And so you will feel the pressure of the guide tube against the skin.
Okay.
And then maybe a little pinch as the needle goes in, but it shouldn't be particularly painful. Okay? So I'll get the needle ready. Okay, I'll hold it against the skin. This is a very common acupuncture point that we use. In there. So that starts the needle, and then I'll insert it just a little bit more to the appropriate depth.
Okay.
There you go.
And how many would you place in there?
I'm going to do 2. My typical treatments will run anywhere from 12 to 20 needles, depending on the individual. Someone like Cristina, who's strong and healthy and young.
Thanks.
Full of life.
We can do a stronger treatment with more needles. However, if I have an older patient, perhaps they have some health issues, and their health is not great, their chi is not strong, we might do a shorter treatment with fewer needles, but do it more frequently.
Okay.
Okay, so for someone like this, you mentioned the placement of the needles. It all depends on rather where people are getting the headache. So for somebody
Correct.
that is getting needles in their hand, say, where would they be getting headaches?
Well, again, it all depends on which points we use in the
Okay,
hand.
okay.
Yeah.
So for this,
so these
what
are
would you
two general points that are commonly used for headaches for many different etiologies. Okay, so this is a point that helps to move the chi and improve circulation.
Okay.
This is a point that helps to nourish what's called yin, or the cooling aspect of the body. But there are many other points that I can use in the hand too. These are just pretty simple.
All right.
Dr.
And
Healy.
then, of course, if you'd like, I can put a point on the top of your head.
I mean, I would like that.
Good.
I would, but we'll
Okay.
have to do that in weather or something, or during a package, because we got to move on. But
Okay.
Dr.
Yeah.
Healy, thank you.